Now a 12 News special report, Saving a Generation. Local impacts of the fentanyl crisis.
We continue to raise awareness about this devastating issue.
I was like, I can't continue on this path because I'm gonna actually not be here if I continue.
And the emotional impact on families.
For the time that we did, we were lucky to have him here with us.
Tonight, we're talking to the experts about the treatments and resources available to you. I'm Mike Montecalvo.
And I'm Shannon Heggie. Over the next half hour, our panel of experts in the recovery community are addressing the biggest issues facing Rhode Islanders confronted by the fentanyl crisis.
Whether you need help right now or are looking for resources for a loved one, we're bringing you those answers.
Plus, we're looking at treatments, outreach, and prevention happening right now in the state. Let's meet our guests from left to right. We are joined by Kathy Schultz, Director for the Governor's Overdose Task Force, where she oversees comprehensive strategy to combat addiction and overdose in Rhode Island.
Linda Hurley, President and CEO of Kodak Healthcare, an expert in the field. She's worked in substance abuse treatment and behavioral health care for more than 30 years.
And Smithfield Town Councilor and former State Senator John Tassoni, host of Recovery TV on WPRI. John is also the President and CEO for the Substance Use Mental Health Leadership Council of Rhode Island. Thank you all for being with us to tackle this really tough topic today.
And this crisis really touches everyone, parents, sisters, brothers, children, and friends. Fentanyl does not discriminate.
Almost 75,000 people lost their lives last year to a fentanyl overdose, including the brother of sports director Sam Knox.
I think about him a lot when I'm working out, and I think just about the times that we had together, and I just think of him in heaven with God, right? I think of him in a safe place.
A life cut short. After years of battling mental health illness and addiction.
Choo choo. What does train say?
Got into high school, started smoking marijuana. That's where it started. My brother Nick passed away in September of 2023.
Sports director Sam Knox's 24-year-old brother Nick Tishanis passed away from a fentanyl overdose. A varsity hockey player, golfer, and honor roll student, he had it all, including a successful career. But demons occupied his life. Who was Nick?
Nick was a lighthearted, caring, smart, hardworking individual. He loved his family. Nick was a very good person, and he just struggled mentally, and he turned to hard substances because of that.
Does that bother you, knowing that he was kind of the total package that he went down this road?
It's just sad. You know, I'm not ashamed, I'm not angry or mad at him at all, and I wish I got the chance to say that to him.
Still, two words stand out. What if?
There were times where he was out of the house when I was home, and he was hanging out with other people and doing things that probably I didn't want to know about or be involved in, and I always thought to myself, why is he not with me?
The unique thing that you're doing, the unique part, is you're going into schools to talk to kids.
Thanks for having me in today. I just want people that age to know that it's okay if you are struggling to get help, and he relapsed. I struggle with the fact I never knocked on his door and just checked on him one more time.
Hoping no one experiences the pain they're feeling, Sam's family has created a foundation called In the Nick of Time, which includes hosting a golf tournament in his brother's memory and talking to high school students.
That's who Nick was, right?
Like here at Tollgate in Warwick.
Sam, why are you doing this?
We're doing this to reduce the stigma against mental health and addiction. I hope that you understand that if you're struggling with anything, and if there's anything that you guys are battling, that it will get better and that it's okay.
When Sam comes in and shares Nick's story and humanize it, I think it just drives a message home.
What gave you that idea to do that?
I see an opportunity to show people what can happen if you do decide to dabble in any of those things. Just 24 years old, right? Had a whole life ahead of him. And that's why I'm here, because Nick was in one of these seats. He just didn't have this.
The person that gave him the drugs, what do you want to see happen to that person?
People deserve second chances. If he's going to serve time, I hope he does, and then I hope he gets out. I don't want him to sit in a cell for the rest of his life and lives a clean, happy life. I'd like to give a presentation with him next to me. That would be amazing. I'm a sports anchor at Channel 12. I love what I do. That exclusive interview is next, but this is the purpose now.
Is this going to be your vocation for the rest of your life?
Yes. Absolutely. And it'll never get old. And I know that Nick's with me when I do those talks.
Is he sitting in those seats?
Yeah, I think he's in one of them, if they're empty.
Someone once said it is during our darkest moments that we must focus to see the light.
He lost the fight. Doesn't really mean he lost the battle.
And we are really proud of Sam turning his grief into action. He decided on his own to go into schools and share this very personal story of his.
And the questions that the kids were asking him, they were truly listening to everything he said. You know, overdoses nationwide and locally finally began trending downward in 2023, but hundreds of Rhode Islanders are still losing their lives each year. And as you just watched in the piece, Nick was in rehab. He was in rehab for 5 months. He was home for the weekend, and then he was going to another facility after that. Linda, we've seen that before. Someone's in recovery, you think they're okay. They come home and then they relapse and then unfortunately pass away.
And it does happen. When someone is, wherever they may be, in rehabilitation, they may have been visiting Aunt Molly in Texas, they may have been incarcerated for a period of time, and they are no longer physically dependent on whatever substance they're using. We're talking about fentanyl now. So what ends up happening is I'm out, I'm doing really well, I'm home for the weekend, or I'm home for the week, and all my friends want to do something special for me because that's going to happen. And I no longer have the same tolerance that I had 5 months ago before I went to rehabilitation. So it would take even less for me to have a lethal dose of whatever street substance that my friends or whoever did something special for me. And it's tragic. It happens very frequently. When one of the highest levels of fatal overdose is with a population of people that get out of prison. And they have 127 times higher rate of overdose, fatal overdose, than any other population that continues to use. And it's because of that.
Wow. And this is where education and outreach comes in. We saw that Sam is doing that outreach on his own. John, what other kinds of outreach are happening in schools and communities, and how important is it?
Well, I think we have to do a better job in the schools right now. When I first got in the legislature, we were number 4 in the country. Right now, we're probably down around 48.
Wow.
Because the money was taken out of the prevention and used in other places. I think now we have to reallocate money and get into the schools and let these kids know how dangerous it is. And it's becoming more and more prevalent. My show on Channel 12, I never even thought that I would have 10,000 people on a weekend watching my show. Because it affects everybody. There's no person. If you took a seminar or you took a questionnaire and asked how many people have been affected by this, I bet you're almost at 100% of Rhode Islanders.
It does not discriminate, that is for sure.
That's right.
Right, we're going to take a little break here. When we come back, we're learning more of the firsthand about the Overdose Prevention Center being built in Rhode Island. Please stay with us. Now to saving a generation, the local impacts of the fentanyl crisis. Our presentation continues now. Welcome back. After multiple delays, construction is underway for the first overdose prevention center in Rhode Island.
It's a place where people can use drugs under the supervision of medical professionals. Target 12 investigator Kate Wilkinson joins us with the details.
Tammy Cruwell says when she first started using heroin, it only cost her $10 a day. But after 20 years of drug use, that turned into $350 a day.
When did you start to realize that this was something you needed to address, that this was a problem?
The whole time I knew it was a problem.
Cruwell and her husband were able to quit 13 years ago after going to a detox center. Dennis Baylor with Project Weber Renew says the drug supply has gone much deadlier since then.
Years ago, before the onset of fentanyl, it was accepted throughout the recovery community. If you slip, you come back. These days, that slip causes death.
Last year, the state's Department of Health reported 404 people have died from an overdose, a slight decline from the year before, but 78% of those deaths involved fentanyl. Right now, Baylor is working to open the first safe injection site in Rhode Island, largely using funds from the state's settlement with major opioid distributors. But he says there have been delays because they had to find a new location. He hopes to have the site open this December.
We decided on a staff to client ratio of 1 to 4.
Some in the recovery community are skeptical about safe injection sites, like Anne Marie.
I can see the benefit of, keeping people safe. But if you're going to help someone not die, what are you doing to help them live?
She started using painkillers when she broke her arm. Now she's been sober for 8 years after she sought help when her mother died.
And I was like, I can't continue on this path because I'm gonna actually not be here if I continue, or I'm gonna disappoint the people in my life who need me there right now.
She feels more money needs to be put towards sober housing, which she says helped her reach recovery. But Cruel thinks safe injection sites will not only give people a safe place to use drugs, but also access to the resources that she says helped her recover.
Therapy, medications, support services.
The people Kate spoke to for her story went to recovery several years ago. What has made the path to recovery more difficult, Kathy? Because that really is the question.
So I know that when you enter into recovery, I'm a person with lived experience, so I know what it's like to get into recovery. I know what it's like to struggle and to really need to seek out the supports that I need. And the key to that is really connection, is really connecting with other people that are like me. And the Overdose Prevention Center is going to offer that. The Overdose Prevention Center is more than just a place for people to use drugs. It's also going to have comprehensive services. So it's really it really is going to be a one-stop shop. It is going to have a peer who understands that person who's walking in the door, understands where they are, where they have been, and will offer them the support that they need.
Yeah, I think there's been a lot of controversy surrounding these, and understandably, I bet a lot of our viewers can't wrap their head around this kind of a place. But there have been 0 overdose deaths at these prevention centers nationwide. Why else are they so effective? I know you were kind of speaking to putting you in touch with the people you need as you seek out this help, right? What else is it about them?
It's really about the connection. It's really about having all the resources in one place and being able to meet people where they are. And then the main thing is that somebody can use safely and they can be revived. It's very, very important. We know that many people are using drugs in private locations or in homes alone, and that's where we're seeing the fatalities. 8 in 10 people are dying in private locations. So this is an opportunity for people to go to a place, be monitored, and by medical staff and also peers, and really their lives literally be saved. Because the reality is that if somebody dies, there is no chance or hope for recovery, right? So that's the key here.
So now, in Kate's story, Anne Marie says she feels funding would be better used for sober housing. What other programs, Linda, would be beneficial for them?
I think we need to really look at not just what we call a continuity of care. So the harm reduction centers, the overdose prevention centers, they're very, very important. Prevention is very important. Treatment, obviously you had mentioned, I've been doing this for a while. I'm a firm believer. And treatment absolutely is critical. And of course, what they call the social determinants. What else is critical? If I have a chronic heart condition, I'm going to be much more healthy than in a sound, safe living situation than I am if I'm living in a, if I'm homeless, if I'm living without a home. So it's everything. There's so much that needs to happen. So the social pieces, medical care, housing. And as you start to feel better, to develop your sense of value. So, looking at what it is I want to do with my life and start to feel who I am again, because this disease it erodes the soul. It really does. I don't mean to be dramatic. It really erodes the soul, so that when you start to reach, however you want to define your recovery, it's so important to have help in each step of that way. So maybe it's, of course, I believe that a lot of times it's medicine, but it's not always medicine. It is incredibly important to have all kinds of connection and the services that you need. So we're excited. We're actually excited to have a sort of one-stop shop as well coming out. And I think that that's the kind of inclusive holding of an individual that allows us to heal.
Yeah, and building up that self-worth again.
Yes. Yeah.
Linda, thank you. We have so much to talk about tonight, and when we come back, we'll continue our in-depth look at treatment and resources. Stay with us. Saving a generation, the local impacts of the fentanyl crisis. Our special presentation continues now. Last year, 404 people lost their lives to accidental overdoses in Rhode Island, down 7.3% from the year before. That's the first decrease we've seen in the state in 4 years. And of course, we'll take any positive we can in this crisis right now. We're hearing from the experts tonight who see this fentanyl crisis firsthand. Let's continue that conversation that we began in the last block on treatment. What's working and why? Any of you can take this one.
What's working? Oh boy. I think the residential treatment facilities are working, but we need to have the insurance companies give the patients more time. 14 days in detox. Most folks are out in 15, 20 days. And it's like, I use this analogy as a mouse on a wheel. You only have so many days in there. You get back on the wheel, you go back out into the community, you use again, and then you're back in and in and out. And I use this as, my dad was in a hospital a few years ago, and there was a gentleman in his room 100 times he was in the hospital. Now, wouldn't you think it would make sense if the MCO said, all right, John, you're going to stay in a facility for 30, 60, or 90 days. That's what happened back when I was in the General Assembly. They were getting 30, 60, 90 days. Now it's not like that anymore. It's not like that. And we need to revert back to that, because if you're not, when you come out, and if you're not ready, you're going to end up back in. And you're not going to become a productive citizen again.
Go ahead.
Sorry. I was just going to say, and residential settings are incredibly important, but I want to go back to the importance of a continuum, because everyone has their own path, and they journey through that path at their own rate. So sometimes I might need a residential treatment, but there's also, again, there's medicine, of course, that's what we provide, as well as a lot of other kinds of services. So I think what's really important is to get Rhode Island small. I believe that we could organize the services in a way that we could move through this continuum and move and speak to each other. I often hear talk about silos, and it's a kind of a criticism of what we do as a group. But the silos are actually regulated. So let's regulate a continuity of care and a collaboration, so that wherever anybody comes, it's a good, strong point of intervention.
And people need that. We want to put some resources on your screen now. If you know someone in your family that needs some help, PreventOverdoseRI.org offers information on local treatment, recovery, and harm reduction services.
People can text, call, or text 988 or chat 988 at lifeline.org to connect with a trained crisis counselor through the 988 Suicide and Crisis Lifeline. You can call Rhode Island's buprenorphine access hotline, telehealth services, to start treatment for opioid use disorder. All of these right now, all that information is on WPRI.com. Coming up, we'll have more with our panel in just a couple of minutes. Saving a generation, the local impacts of the fentanyl crisis. Our special presentation continues now. Welcome back. The emotional toll for those left behind by the fentanyl crisis is enormous. Last month, the local library and coalition joined forces to raise awareness and help families cope through a butterfly garden. Take a look.
We have 2,020 butterflies here today. So this is our third year, and this is a butterfly memorial garden in honor of International Overdose Awareness Day.
The purple are the lives lost, and the yellow are the ripple effect, those affected by the loss. The 404 Rhode Islanders who passed, the 15 East Providence residents who passed.
It's such a large, impactful display that people don't really understand what the number 404 until they visibly see it. You really get that visual of, my goodness, this is a huge number. This is really impactful.
The visual display of the butterflies drives home the impact of accidental overdose deaths in our state and in our community.
And this was really powerful when you saw that in East Providence. Kathy, talk about the strategic plan that you have.
So the Governor's Overdose Task Force of the state has a strategic plan. The task force itself has been around since 2014 and has revised its action plan to really focus on the continuum of care. To, as Linda was saying, the continuum of care is necessary in order for a person to enter into recovery, to prevent overdoses, also to protect our youth. And we really need to focus on the social determinants of health. Make sure that we're looking at data to drive action. Racial equity. We know that our BIPOC and our Latino communities are disproportionately impacted, and it's just really important. And we have 4 pillars of the task force that have remained, in addition to the cross-cutting pillars, and that is prevention, harm reduction and rescue, treatment, and also recovery. And with the key is to move through all of those 4 pillars.
Yeah, you need all 4 to really help people here. Well, we appreciate all of you for being here tonight.
And we want to thank you for joining us tonight, Kathy Schultz, Linda Hurley, and John Tassoni.
You can find more information and resources right now on WPRI.com. Good night.